Medical school in Uzbekistan and in Turkey is 6 years. The 2 years is theoretical, no, 3 years theoretical years, and the 3 years are clinic like this.
In both Uzbekistan and Turkey.
Yes, yes. Yes.
It's it's
But in Uzbekistan, the 6 years, if you are sixth class, you need to choose your own specialize. If you want to be cardiology, and the 6 years, you go to only cardiology clinic, and you go to cardiology hospital. But in Turkey, it's not. You have 6 years learn all. If you finish after, then you must to choose.
but even in Uzbekistan, after you finish your sixth year, for example, if you want to be a cardiologist, you still have to
No,
go to cardiology residency.
no. If you
Oh,
are in Uzbekistan, if you have finished university, you will be You will not to be a doctor. You will be assistant and like this. After 6 years, you must to learn 2 years magister degree to your specialize. Your cardiology, neurology, what do you want? You must to learn 2 years. After 6 years. After then, you will be a doctor.
yes.
What do you want? Like this. But in Turkey, I said I want to be maybe neurology. Turkish teacher said me, if you want to be neurology after graduating university in Turkey, they must to pass exam. For example, your pound is 68, maybe 68. In the schedule, they have pound, and if you are 68 pound, they must to be pediatric. If you are high pound, you can be surgery doctor, like this in Turkey. For example, I want to be surgery doctor. In surgery doctor, you must to take 90 pounds, but I take 70 pounds. I cannot be surgery because they said your pound is 70. For this reason, you can be cardiology or neurology. Like this in Turkey. I shook it, but in Uzbekistan, it's not.
Well, a lot of it sounds familiar to me. I would say I have some experience with Brazil, which is where I went to med school, and I also have some experience with the United States. Because originally, when I graduated from medical school, my original idea was to go to the United States for general surgery residency. So even though I did not go, I have some knowledge about the process and how everything works. And I'd say Brazil is more akin to Uzbekistan. It's also 6 years here. The first 2 years of University of Medical School are basically fundamental sciences like biochemistry and physiology. Then we have 2 years of like theoretical learning of clinical sciences like dermatology, cardiology, nephrology, and then the last 2 years are what we call internship, which is different from the internship in the United States, which is basically you'll be working supervised. And we also have a 3 months to 6 months elective when you just see the discipline you want to pursue. So, for example, you spend 3 to 6 months in surgery. So, in this sense, it's closer to Uzbekistan. However, once you graduate, you are already a physician. So you can choose to pursue your residency in cardiology, in neurology, but you can also just work. I don't have a residency, for example. I went to med school, stayed there 6 years, graduated, and I never actually went to residency, which is incidentally what you call masters. I'd say if you said masters to a Brazilian, for example, they would understand, but we generally call masters when you go into a more theoretical study and residency when you are actually learning to do something. But what you said about the scores determining your specialty matches a lot from the United States, for example, where many residency programs have cut-off values. So if you want to go to general surgery at Mayo Clinic, for example, you need at least a 245 score on the step one, for example. So it ends up working a bit like that.